Welcome, this is attorney Victor Cardoza. Welcome to my show, Seriously with attorney Victor Cardoza. Now, let me tell you some thoughts I got about chiropractor. Let me tell you about chiropractic care. I'm a believer of it, and so are millions of other people in the community, but there is a stigma to this field of medicine, and let me tell you a little story I had in a trial I did just several years ago. And I was in trial. It was a car accident case, and the insurance defense attorney was up to his usual tricks, saying things to the jury panel about his thoughts about all the doctors who took care of my gravely injured client. And you know what one of the lines was that was said by this attorney, and I hope he's watching here right now if he remembers this. He said, "Ladies and gentlemen of the jury, you are going to hear a story about how this lady," and I won't say her name now, but was treated by a multitude of medical providers, including a chiropractor, a person who is licensed in the field of chiropractic medicine. And let me tell you about chiropractors. This person who treated this lady who says she's so hurt is not even qualified to prescribe an aspirin. I was just sitting there in my chair, clinching, wishing I had the ability, if I weren't an officer of the court, to take off my shoe and whack him upside his head. And you know what? Over the course of this 2-week trial, I think the jury kind of agreed with me, because they whacked him for a verdict of over $500,000. So I hope you remember this. I hope you're watching, Mr. Initials NC. Because I want to talk about chiropractic medicine and how I believe in it and how it benefits the community. And to help me do so, I have the great Dr. Craig Calder.
Thank you. Thank you very much.
Licensed chiropractic professional here, chiropractic physician. Why don't you introduce yourself to all this?
Hi.
It's a great audience here.
Great audience, and I'm
in the Las
happy to be
Vegas
here,
community.
Victor. Thank you for the honor. I'm Dr. Craig Calder. I'm a chiropractic physician with Nevada Rehabilitation Centers. I've been practicing for 22 years. I celebrated last week.
Congratulations.
So it's great. I've been here since December of '99, working in Nevada and the wonderful city of Las Vegas.
Now, Nevada Rehab Centers is a large group, isn't it?
Well, we're a medium-sized group. We've got 3 offices, 3 chiropractors. We've got, in a case of a personal injury case, convenience is going to be paramount, making it easy for the client to get to us. So we've got 3 offices in town, one up in the down in the Henderson area, off of Horizon Ridge Parkway and Green Valley Parkway. I'm in the Sahara and Lamb office, and then we've got our home office over on Tenaya near Mountain View Hospital. So covering the whole valley.
And your place is on East Sahara, close to the Boulder Highway area? Okay,
yes.
Great. How is that practice doing for you?
It's doing okay. I enjoy it. I get a great group of patients. The clientele is wonderful. They're interested in getting better, and it's very rewarding to help them achieve their health goals.
Large Latino community in your area.
It is. We do have a bilingual staff. I speak enough Spanish to communicate on a daily basis. How are they doing, and saying hello and goodbye. But to get into a conversation, no. But I have a staff who will help me with that.
Why don't you tell us what is chiropractic manipulation, just to educate some of the folks who are not familiar with it?
That is a wonderful question. There are multiple ways to put motion into the spine, Victor. If I may, joints are supposed to move. And the chiropractic manipulation.
What happened to this poor guy?
He lost his head.
Okay. All right, we got a mannequin here.
So
exhibiting the lower back or something like that.
A lumbar The vertebra is separated by a disc. The nerve, the spinal cord comes through the spinal canal from the brain down, and then out the nerves to all your organs and to all the tissues in that general area.
I've heard those discs referred to by doctors explaining things to regular people like me as a jelly donut. Have you heard that before?
Absolutely. I use that analogy all the time because if you look here, there's a jelly middle called the nucleus pulposa, surrounded by a bunch of little rings, and these rings keep that disc material contained, so that when you move, it flexes with you, and it acts as a shock absorber when you play tennis. When you're jarring for your tennis, boom, boom.
Or like rubber tires on your car, right?
That's
similar like
another
that?
analogy.
Okay.
So, and it also, more importantly, keeps the space so that nerve doesn't get pinched. And that nerve, the communication from your brain down, goes out to every organ. Your nervous system controls and coordinates everything. So it's very important to keep your nervous system working. Wouldn't you say?
I hope so. So let's see. Give a common example. Maybe from my own experience. I have a pain in my back.
Mm-hmm.
It's going down my butt, down on my heel, and I can't even bend down to tie my shoes.
Certainly.
I come see someone like you.
Yes.
What happens next?
It's very important to get a full history of the patient. There are many different reasons why they can have the symptoms you described. So getting a full consultation, asking all those pertinent questions to find out when did it happen, how long have you had it, what aggravates it, what makes it feel better, gives the doctor a better understanding of your condition. Then a thorough exam is done. We'll do an orthopedic examination, we'll do a neurological examination to see what tissues are involved that's causing the symptoms you're presenting with. After that, a chiropractic examination is done where we're going to look for postural changes, postural twists in your spine, and what we call a subluxation. Have you ever heard of subluxation?
I have.
Okay. That is what the chiropractor treats.
So maybe our folks have.
Well, a subluxation is simply, you ask 10 chiropractors, you get 10 different descriptions of it. But it's a bone in a vertebra that is not moving properly, putting stress on the nervous system and the tissues around it. Now, left long enough, it will cause symptoms.
Okay.
So the chiropractic manipulation, what you ask, many times we'll use our hands to put a short, fast force into there. You might or may not hear that snapping, cracking sound. We call that a cavitation. Nothing's breaking.
And the patient going, oh my gosh!
Sometimes. Yeah, we have screamers, we've got jumpers, they flail. I mean, it's all part of it. Everybody's different, and we're very respectful of those patients. There are some patients, Victor, that cannot withstand that. They're too tender or they're scared. They don't like to hear that cracking sound. And then we have instruments. We have instruments that we can use to help them through their fears.
So this is all part of, before you do this crunching of the bones or cracking of the bones, you do the exam, right?
Absolutely.
And
Absolutely.
Some clues of what type of exam you got to do are from, I guess, looking at what the patient's doing. Like if they're walking in crooked, leaning to the left or the right.
They say the eyes are the window to your soul. The posture, your posture is the window to your nervous system and your spine. If you see somebody, and we all see this patient, they're sitting on their computer or their phone, they're hunched over, grandma walking down the street. That's a postural change. We have scoliosis. We have a high shoulder. These are all things that chiropractors are trained to observe, which drives my wife crazy because now I'm looking at her, look at those hips, look at those shoulders. So I'm always pointing out because it's blatantly obvious.
That's your excuse for checking out other ladies, right?
I didn't say that. Trust me, I'm a doctor.
Oh, look, our hips. So let me, the reason I was so adamant to our people out there in our introduction is because I've had the benefit of getting chiropractic care. Back when I was a young teenager playing Pop Warner football, it seemed like to be an annual rite of passion where I would get whacked by some much bigger dude and I could barely walk.
Right.
And I went to my primary care physician. They wanted to give me some pills. They wanted to give me some hot packs and rest, and I wouldn't get better. And then my folks introduced me to people in your profession, and whammo, in a few days, at least I'm feeling much better and got back to normal. And this happened for years and years. And then through tennis, I would do things stupid. I'd let myself get too fat and then go out and play and ruin myself. So I would get fixed up by people in your world.
Wonderful.
So I have experience, and I believe it. And I've also had the chance to see thousands of my clients get the benefit of your area of medicine. So what I want to have you address and say in your words, why do people beat on your profession like I just described? What's your sense of this?
We are inundated with thousands of hours of advertising. Take this medicine, take this medicine. Although we tell our kids don't do drugs, every time there's a cold, every time there's an issue, we throw a medicine at them. It's a quick fix. It's the easy way out. What people don't realize is chiropractors have the same schooling as a medical doctor.
Oh, what is the history of what education you have to go through?
So our schooling, the textbooks, the tests are the same as the chiropractor. My physiology teacher used the same textbook as Washington Medical School in St. Louis. He gave them the same tests. The chiropractic students average 5 points higher on the test than the medical students. That's coming from him. We do that, the same education. Where our education shifts is we don't do rotations in a hospital. So we'll learn about cardiology, but we won't do a cardiac rotation.
Okay.
We will do obstetrics, gynecology, but we don't deliver babies. We know enough because of the book work to say, that's what the problem is, go see your OB-GYN. You follow me?
All right. So
and then we have 4 national boards that we have to pass. And then there's state licensing exams. Each state is different. So there's a rigorous schooling that goes on that most people don't realize.
So education is deep, it's extensive, there's tests you got to pass. So getting back to this quick fix theme that America likes to have, does that include this dreaded opiates and pills and
unfortunately, we've gotten
injections?
Into a whole world of hurt. Getting those opiates, yes, it took away the pain, but look at the side effects. We've got an addiction crisis that's out of control. And it never got to the problem of many of those patients' pain. If it's a musculoskeletal pain, then chiropractic many times will afford that patient hope of recovery. The challenge with that is everybody wants that quick fix. They don't want to take responsibility. Give me a pet medicine, I can do whatever I want to do. They're not going to eat right, they're not going to exercise. It's that negative mindset, that limiting mindset. In the rehab centers and the docs that are there, we want to empower the patient to get to the cause and take action and take their power back, and we will coach them through that. So with chiropractic manipulation, with exercise and diet, many of our healthcare issues, heart attacks, cancer, the 2 number killers, will then go down. I'm not going to say we're taking it away completely, because there are many different causes of those, but most of those are lifestyle.
So give us a window of hope here. Say a common scenario, someone slips at the market, falls on their butt, and they feel crooked, and they're walking in with you. If someone like that, let's make a person a 40-year-old lady, okay? Maybe 20 or 30 pounds overweight. There you got the picture. So this lady comes into you. What assurance can you give her that she's going to improve, and over what course of time can you give her? Just a general example.
Absolutely. With chiropractic care, after a full exam is done, x-rays are taken to make sure there's no congenital anomaly, she's built normally, there's no broken bones, there's no dislocations, there's not a tumor that could be hiding in there that she didn't know about. We are looking for those. We take the x-rays and then we'll devise a course of treatment. Many times that will be daily for possibly the first week or 2, then 3 times a week. And those treatments will be spinal adjustments to restore the biomechanics of the spine. We'll use therapies to calm down the inflammation which is causing their pain, and reestablishing the normal biomechanics. And it's a time-based treatment. Every case is different. Every patient is different. What worked for this lady, maybe she was a chiropractor 5 years ago because she twisted her back lifting her child. That's a different injury. And it was 5 years ago. So each case is different, and that's what patients need to understand as well.
And the option is pop those opioids.
Take a pill, And the next time the pain comes back, take another pill and take another pill. You're not getting to the root cause. You're simply putting a Band-Aid on that. Okay? But the challenge with the opiates, we got ourselves, they're addicting. And then, let's say she slipped and fell in an establishment and there's a lawsuit now because they didn't clean up the floor. There's liability. Well, at some point in time, that case will have to come to an end. And now, where are they going to get that medication? Because they're addicted to it now. Now the case is over, and unless they have health insurance and their medical doctor will continue to prescribe that medication, they're stuck. So,
because the problem's been masked through the popping of the pills.
Exactly.
Okay.
It's an easy way out.
So you tell us about within a week you should sense some improvement or something, but
many times you'll get fluctuations. You know, pain is a really tricky thing to judge. We can't see it, we can't measure it. We have to use questions and patient perceptions.
what if we take the critics' extreme end by using what you just said against you? Well, you can't take pills forever, but you can't go see Dr. Calder and get adjusted forever either. So is there an end for when you're going to stop treating them too?
There will be times when I will give patients an end. Okay, this is where you've met what we call maximum medical improvement, where the doctor has determined based on their clinical experience, based on their education, that they don't feel any further care is going to benefit the patient, or they're not going to change with care or without care. In a legal case, okay, you're done. Now, what if they're just coming in because they want to be healthy? That's a lifetime thing, possibly. I mean, I brush my teeth a couple times a day. I floss every day. I mean, it doesn't stop because I don't have a problem. But that's not true either, because I do have a problem. 2 weeks ago, I went for my 6-month checkup with my dentist, and I got 2 cavities, even though I brush my teeth and I floss and I have a decent diet. Now, I have no toothache.
You're asymptomatic.
Asymptomatic.
Free of aches and pains.
Right. I look in the mirror, I don't see anything.
Okay.
Because he saw it on the x-ray.
All right.
Now, I have scheduled to get that corrected. What about your spine? What about your spine?
Well, let's use this again.
Okay.
You're picking up a good example,
This is
right?
a normal spine. Smooth edges, the disc is healthy and thick. The opening, what we call a foramen, that the nerves come out, is open, so that nerve is free. With aging, we start to get the disc degenerating, or degenerative disc disease. That starts to crunch down and impinge these tunnels. Over time,
everyone's looking worse and worse here.
arthritis, degeneration, exactly. But here's the tricky part. This may or may not be painful. It's degenerating, it's wearing out, but I don't know about you. I mean, today's the oldest I've ever been. And tomorrow I will be older. I want to live as healthfully as I can. I want to have vitality as I grow older. I can't stop aging, neither can you. Like I tell my patients, I'm good. I'm not God. There's 2 O's, not 1. I can't stop aging, right? But if I can have this degeneration at 90 instead of, well, I'm 57, so 60.
Okay.
Wouldn't that be a good thing?
Sure.
And
But that guy doesn't look too good.
Chiropractic can help.
And what is this? This looks like a mess.
This is severe phase 4 degeneration. It's locked up, there's no motion, and this patient is not healthy. I don't often see this patient in my office.
Okay. I guess if you adjusted someone like that, you might just break the whole spine.
Well, it'd be very difficult, but they're going to get minimal benefit from it.
Well, thank you for being open about this. You've heard of lawyer jokes. You've heard of chiropractic
Absolutely.
jokes, okay? I mean, it's just a sense that I get that the people who criticize people in your profession are the people who haven't had the benefit to try out your profession and what medicine you can give people. Is that what you see too?
I see this limiting belief because they've been told, don't go to a chiropractor. And I asked the patient one time, she said, well, I was told, my neighbor told me, don't see a chiropractor. I said, is your patient a chiropractor? Because I might take another chiropractor's idea. No. Are they a medical doctor? No. A nurse? No. I said, what is your patient? An EMT?
I think it's just a running joke that's fed on itself. You remember the show 2.5 Men?
Yes.
How many jokes of chiropractors did you see on that?
It is. If you can't laugh at yourself, but there's got to be an understanding. We are a profession. We're the third largest health profession. Medical doctors, dentists, chiropractors. We help many, many people. There's research is there to support it. They just don't understand. And the medical doctors are getting better. It's getting better with working together. But there's still that bias out there that we're not real doctors because we don't prescribe medications.
Or you don't cut people up with a knife.
I don't cut people with a knife. Now, if I can prevent them from needing medication, if I can help them avoid a surgery, then they're better off.
Well, let's lead into that before we finish, and then you can give us all your great contact information, okay? So people can call you and get some more treatment and help. You talked about the dentist doing examinations on you in the form of preventative care, preventative maintenance. Is there such a thing for chiropractic physicians and their patients? Is there preventative care?
Absolutely. The research, relatively new research, shows that when the patient followed the doctor's recommendation of a routine system or checkup and adjustments, they had fewer days of pain throughout that year. They were seen more frequently than if you just left the patient to go, come in and you're hurt. Those patients were seen less, but they had more days of pain. So if you want to have less painful days in a year, then follow your chiropractor's advice, come in more frequently than you think you are. They know better about your spine, and they know the research, and follow their direction.
Does that mean, everyone's different, right? Everyone wears a different set of shoes, puts their pants on differently, or I don't know. But my point is, are you saying see you every 2 days or every 6 months if you're feeling good?
There are times when one time a month is good. There's times when, I had a soccer player, I saw her after every game. She was a competitive high school soccer player looking for that slide tackles and heading the ball. She needed it more.
Just like the pro athletes get their massage and adjustments after
every
their
NFL
sport.
team has at least one chiropractor on it. At least one chiropractor on every NFL team. So
Well,
they
I got to see you at Raider Stadium coming up, so whatever it's going to be
I
called.
talked to the current Raiders chiropractor, and I don't want his job. He's not coming to Vegas.
So preventative maintenance is a way to go.
Yes.
I got to tell you, I appreciate you being flexible and understanding these jokes, and I think you showed us. You brought up another brother fella. Is that a?
It was fine.
Is that from a cadaver or is that a plastic?
Plastic model. And I use this to educate my patients when they have headaches why they're having headaches. Because these muscles here.
Well, show people the rest of the
you got
bones.
Different muscles.
This is the front, of course.
This is the front. Your organs are here. Your back. Muscles go from your hips to your low back, connecting. So it's all connected. We need to work the spine as a complete unit.
Thank you for bringing your examples, Doctor. So, tell our great audience where they can find you. Again, phone number, address,
The best
websites.
way is to call our central number. We've got 3 offices. Our helpful staff and knowledgeable staff will help you find the office that's closest to you and answer your insurance questions and finance questions. That number is 702-309-4878. And that's our central number.
For Nevada Rehab Centers.
Nevada Rehabilitation Centers. Yes.
And I want all our people out there to ask for Dr. Craig Calder. Thank you, sir.
Thank you. Thank you. Been an honor.
Thank you, everyone, for listening.